Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Treatment of heart failure. So, in the treatment of heart failure, we have two stages. One, we have American Heart Association stage, and we also have NYHA stage. So, based on these stages, the stages will differ and the management will differ. So, if the patient is in American Heart Association stage A, is also called as pre-failure according to New York Heart Association, that is NYHA. So, the pre-failure of NYHA classification or stage A of AHA classification states that there is no symptoms in the patient, but the risk factors are present in the patients. In such cases, if there is no symptoms but if risk factors are present, then we will ask the patient to undergo lifestyle modifications, like you will have to treat the obesity. You will have to treat the obesity. You will have to ask the patient to control hypertension, or you should ask the patient to control his diabetes mellitus, and lipid levels should be controlled. Okay. then uh, then even after that, if there is here there is no symptoms, only there are risk factors, so we can also prefer giving ACE inhibitors or ARBs based on the risk factors. Then stage B of American Heart Association corresponds to stage 1 of New York Heart Association. According to this, here symptoms are present with severe exercise. Symptoms are mainly present with severe exercise. So when symptoms are present with severe exercise, because the symptoms are present, we should start treatment. So we can give ACE inhibitors or ARBs are given as the first line. We can also give beta blockers, and diuretics are also indicated. And these diuretics are given mainly to relieve the acute edema, if any. Because symptoms are present, based on the symptoms, we should give angiotensin converting enzyme inhibitors or angiotensin receptor blockers, beta blockers, and diuretics can be given. Now, according to the American Heart Association Stage C or New York Heart Association Class 2 or Class 3, this states that here the patient has symptoms definitely with marked exercise. That is, symptoms are present in marked exercise, that is Class 2. If we say that the symptoms are present with marked exercise, then this is Class 2 of NYHA classification. Or if symptoms are present even with mild exercise, then that means it is Class 3. If symptoms are present with marked exercise, then that is NYHA Class 2. If symptoms are present with mild exercise, then it is NYHA Class 3. So in both these conditions, because symptoms are present even with slight exercise, so we should these symptoms are not sufficient, these drugs are not sufficient. Now you should add some more drugs. So you will have to add aldosterone antagonists are added, and this is the stage where you can think of adding the digoxin if required, or any inotropes. Digoxin means, or any inotropes can be added if required. Then then here we can also think of adding uh, hydralazine can be considered, or nitrite can be given, nitrates can be added. Then we can also think about cardiac resynchronization therapy can be done. At this stage, we can also think of cardiac resynchronization therapy. Okay, next. Then we have, according to AHA stage D or New York classification stage 4. Here, if the patient has severe symptoms even at rest, if the patient has severe symptoms at rest, then in such case we should think about any transplant, whether we can do any transplant, or we can think of any giving the patient any ventricular assist devices, like left ventricular assist device can be given to the patient.
thank you and thank you for watching.